this presentation, the virus of focus is SARS-CoV-2 that causes Covid-19. My name is Natila Holness.
My name is Josephine Francis White.
My name is Callesha Bruce.
My name is Bethanie Johnson.
And my name is Melleisa Robinson. Good afternoon, Microbe students. Welcome back. It's your first class, first face-to-face class since COVID. How are you guys feeling?
Good, miss.
Good. That's why you have on 2 masks, miss. Alright. What a coincidence it is. Our virus, our focus topic today is SARS-CoV-2. And that is the causative virus for COVID-19. So one of your classmates, Callesha Bruce, she has a very interesting story to share with all of us, and I want you guys to listen keenly to what she's saying. So Callesha, are you ready to share your story?
Yes, miss, but I'm just a little bit nervous.
Don't be nervous, man. See your classmates, they're excited to hear you this morning.
Alright, so hi guys.
Hello.
Should I come up there? I can stay here.
Come on, man, come on.
Miss, I want you to do catch COVID.
Just wait and listen up.
Okay.
Come, Callesha, come.
Alright, so as you know, I basically get COVID-19, right guys? And for me personally, what I know about COVID is that
Bethanie,
it is
come
quite
back to your seat.
It is quite true. Sneezing, coughing, or close contact to other persons.
Let's see how it all unfolded. Callesha was at home sweeping the backyard as her mother approaches.
Alright, my dear, put it down. You're burning up, man. What is happening to you?
I feel weak, baby. I feel weak.
Alright, come and go lay. Come, let's go and lay down. Oh, Jesus. I wonder when you feel when you put on a mask, John, you go pick up COVID round here. Me tell you, if you stay here, you know, but not for hell would you listen. Sure.
I am Melleisa Robinson. What brings you to the hospital this afternoon?
Where me go find a room about?
Mommy, take the man juice off and me married. Me head a pain.
That's so sorry, man. If you know if you stay here.
So you said, what has been happening? What has been
She's
happening?
been coughing like crazy, complaining of sore throat and shortness of breath.
Okay. And you are Callesha Bruce, right?
Yes, me go dead.
And you are her mother, right?
Me go
What is
dead.
your name?
Josephine,
Me go dead.
Alright,
big man, relax yourself.
here's a mask. Callesha, try to put on the mask. I don't know if you can manage it, alright? So what you say are some of these things that has been happening to you? I can notice that you're coughing. What else?
I feel hot. Mommy put one big hot bag juice for me head.
These are the early signs of
I go
COVID-19.
dead.
Callesha, calm down. Alright, let me just write down these things. Alright, so what I'm going to do now, I'm going to do your temperature. Alright? Let's see your temperature.
Tell her if you stay home in hours.
Wow,
Tell her if you stay home.
104.5. This is high, mommy. Alright, this is high.
Nothing more than a COVID before they go. See you make them and all the thing.
Mommy,
Mommy, I go make me dead. Mommy.
Relax yourself, man.
hands your finger from here. And I'm going to do your blood pressure.
Calm down, man. Can not take that serious.
Try to relax a little bit, mommy. And you're going to look your pressure.
Me I go dead, guys.
No, Callesha, calm down. You see, they try to calm down. Everything will try to sort out itself. Stretch out the hand for me. The pressure is good. 118/74. But the oxygen level now 88. That is a bit low. The normal range is 95 to 100. So I'm going to go and talk to the doctor and come back. I'm leaving this on her finger because the oxygen level is low. Alright, I'm going to talk to the doctor.
I am Dr. Johnson, and since you're COVID-19 suspect, I'm going to do the swab test. And please relax, it's nothing to worry about. It will feel a little bit uncomfortable. It will feel a little bit uncomfortable. Please breathe.
Now whole night here.
Please relax, please relax.
If you didn't turn your head, none of this wouldn't happen.
Please relax. Touch my head.
Thank you, Callesha, for sharing your story. And guys, no need to be afraid. Remember, you have on your mask, you have your sanitizer. And did you listen keenly to what she was saying? And Miss Bethany, you got up. What did she say? Give me one thing that she shared.
Miss, she said her head was hurting her. She went to the hospital and the doctor pushed a thing in her nose and she was so frightened.
And what is that thing called? Anybody can tell me?
It's the swab kit, miss. Yeah, it was very uncomfortable. That's why.
Alright. So, as Callesha shared about her experience with COVID-19, so we all know that the virus that causes COVID-19 is SARS-CoV-2. Alright, good. And where was it first identified? Did you guys know? Because I gave you the research to do.
Me, miss.
In China.
You can't put up your hand.
Me answer before you.
Settle down. Alright, and we know that it has a high transmission rate. And it also SARS-CoV-2 virus. It is the severe acute respiratory syndrome coronavirus. It is a strain of coronavirus that causes COVID-19, right? And as stated before, the first case was discovered late in China, late December 2019, right? Which in early January 2020, that is where it was announced that the cause of coronavirus is SARS-CoV-2. In March 2020, the World Health Organization declared a world pandemic. Alright, so Natila, tell me some of the signs and symptoms you heard when Callesha was sharing her story.
She had headache, coffee, fever, tiredness, loss of smell, or taste there.
Alright, yes. And some of the other symptoms we know is shortness of breath, chest pain, loss of speech as well can happen. Next point, transmission and testing. Anybody knows any way that COVID can be spread? Alright, Josephine.
Touching contaminated surfaces.
Right. Bethany?
By direct contact.
Yes, correct. Callesha?
Well, by coughing or sneezing on another person.
Alright. So we have portals of entry and exit. So we know we have the respiratory tract and we have the mucous membranes as well. Alright, and exit now, the portals of exit would be through respiratory secretion, such as you stated, sneezing earlier, coughing, things like that. Also, another portal of exit is through saliva, and can you believe it too? Feces as well.
Really?
Yes.
Miss nobody now touch up faces.
You might be surprised.
Alright, so let us move on to testing. So you remember Callesha told us that they put a swab in her nose. Now, Bethany, can you read that slide for me?
Miss, where is it? Which slide?
That means you're not following.
Miss, I'm seeing the slide that talks about table illustrating descriptions and examples of mode of transmission of SARS-CoV-2.
And I just said, what did I answer to you, Callesha? Testing, right?
Testing.
Alright, testing.
So the test.
So types of tests and the purpose. So we have the purpose of the test is to detect the infection with SARS-CoV-2, right?
Yes,
so the
please.
types of tests now. Can you read that for me, Josephine?
We have viral testing, NAATS or PCR, which is highly sensitive and specific, usually lab-based, and antigen tests. This detects viral protein faster and cheaper but less sensitive.
Alright, good. So as you heard, we have the antigen test and we have the PCR test. Interpreting results. So the positive viral test, that indicates a current infection, right? Then we have the negative viral test. That one does not rule out infection, especially with antigen tests. It repeats or confirms if clinically indicated. And then we have the antibody test result. This indicates the past exposure or of infection or vaccination. It is not reliable for assessing immunity levels. So now we will look at detection. So there are several ways to detect COVID-19. And I want one from each of you. We want one from each. Alright.
Test. This is the gold standard, and this identifies the virus genetic material.
Alright, thank you. So that one was the PCR test. Next one.
We have the antigen test. This test, known as the rapid test, detects vital proteins, and results you will get it back like minutes.
Alright, correct. Yes, Natila?
Then we have the antibody blood test that detects past infection.
Alright, and another way of detection, Bethany?
Test imaging that uses X-rays and CT scans that can reveal damages of lungs caused by the virus.
Alright, so the rapid antigen test, as Callesha said, we get that one in minutes. The PCR now, that one takes a little longer. Alright, and then we have the antibody test, which can show us past infections.
Yes.
And then we have the chest x-rays, which doctors did you have a chest x-ray Callesha when you were in the hospital?
No, miss. I'm just
Alright, so the virus replicates. So we have different stages of replication. We have the attachment and entry. We have the release of RNA, translation, RTC formation, RNA synthesis, structural protein synthesis, assembly, release, and new infection. So on the PowerPoint, you can see the image with the replication process. You're seeing it?
Yes, miss.
Alright, next we look at the morphology of the SARS-CoV-2. And what does morphology mean again, class?
Structure.
Correct, the structure. So when you look at the SARS-CoV-2 virus, what does it look like to you? What comes to mind when you look at it? Yes, so it has
some juki like a maca.
Look like collins.
right, so it has spikes, right? And then as you look closer at the image on the PowerPoint, look at it guys, you see the envelope protein. Are you seeing that?
Yes,
This is the membrane protein. Alright, and then you see the nucleocapsid protein as well.